All right, welcome back. Thank you so much for staying with us. It's Health Thursday, and I want us to continue this conversation we started in January, which was Cervical Cancer Awareness Month. Of course, even beyond awareness, we want to ask the question, are we really winning the fight against cervical cancer? In Kenya, it remains one of the leading causes of cancer deaths among women, only second to breast cancer. But despite the availability of HPV vaccines, and we'll be finding out if at all we have enough HPV vaccines to accommodate all women. And of course, we also have screening services. How are we doing as a country to eliminate cervical cancer? With regard to WHO's targets by 2030 to eliminate cervical cancer, that is the 90-17-90 target by the WHO, that is World Health Organization. And we'll be getting deeper into that to understand that target and what it means for us as Kenyans, and of course from the global lens in general. My guest in studio is Afrin Shafi. She is a gynecological oncologist. That's quite a mouthful, but she'll be telling us more about it. And the question we are also asking you this morning is, what myths have you heard about cervical cancer? Talk to us on our socials. Here's the question: what cervical cancer myths have you heard that might be stopping women from getting screened or vaccinated? TV47 Kenya on Facebook and on YouTube, and next at TV47 Digital. You can also send us your feedback on WhatsApp, 0793 267 793. Karibu sana, Afrin.
Thank you.
You're ready?
I am.
Let's just start with, of course, the basics, helping our viewers understand what cervical cancer is. You know, let's talk to the people who don't walk this shoe. We have the men who don't know really what even the cervix is, and where, if at all a woman gets cervical cancer, then which area is affected exactly. And also we have the women who, you know, we don't have cervical cancer. How would you describe it to us?
So basically, I'll start by telling everyone what cervical cancer is and what is the cervix. Mm-hmm. So basically, we have the uterus, that is, in Kiswahili we call it the kizazi, mm-hmm. and then mdomo is the mouth. Mm-hmm. So basically, if you directly translate it to the Greek, it's supposed to be neck, mm-hmm. but we would say mlango la kizazi, mm-hmm. meaning the opening of the door of the life. So this is the part which we usually see through the vagina when you insert an instrument that looks like the shape of a duck's beak, you know, mm-hmm. which we call as a speculum. So as doctors, when we insert this what we'd see is the cervix. Mm-hmm. There's an internal part of the cervix, which is what we see, and then the external part of the cervix is what we see, and then the internal part of the cervix. Mm-hmm. So now cervical cancer develops in the cells of this opening or mouth of the uterus. Mm-hmm. And of course, this cancer, we will talk after as we go along, what causes this cancer. Absolutely. And how does it develop. Mm-hmm. So for just in layman's terms, I'd say it's the door to life, mm-hmm. door of the uterus. All right, now it affects that door of the uterus, of course, you know, just the cervix area, because of course as women we know where the cervix is, but now what causes it? So what basically causes cervical cancer, 90% of the cases are caused by a virus, mm-hmm. known as the human papillomavirus. So we have over 200 strains of the human papillomavirus, but most of these strains are basically just innocent. However, we have high-risk strains that are around 14 to 15. Now these strains, why we call as high risk is they can actually mm-hmm. cause cervical cancer. So most women who are sexually active mm-hmm. will in their lifetime once acquire HPV virus. Mm-hmm. However, we have an inbuilt immunity, mm-hmm. and most of us, over 70 to 90% of the women are able to clear up this infection. Mm-hmm. However, in a subgroup of women where, say, the immunity is suppressed or the other risk factors, mm-hmm. the virus tends to persist. Mm-hmm. And this virus can persist for years. Eventually, it starts causing changes in the cells of the cervix. Mm-hmm. So the lining basically has cells. And these cells is what the virus attacks. Mm-hmm. But as I mentioned earlier, most of the women are able to clear up. in those which the virus persists, say women who have infections such as HIV, or women who smoke, this puts them at a higher risk, or say women who have multiple sexual partners. And why I say this is because when you have multiple sexual partners, it increases or exposes you to a range of these high-risk viruses and the persistence. As when you have more viruses, the persistence and the risk of persistence increases. So it persists and eventually starts causing changes in the cells. The other thing is sexual initiation at a very young age. So at a very young age, you know, the cervix is very young, the cells are very immature, so they're more susceptible. It's like children, you know, when they're young, you know, the immunity is, can I say, it's less. Likewise, when the sexual initiation is started at younger ages, say 14, 15, and currently we have data to say and suggest that the sexual debut in the teenagers in Kenya is quite
increasing.
Yeah, it's at a very young age, you know, like 14, 15 years of age. So this in itself is one of the risk factors of developing cervical cancer due to the persistence of this virus.
So of course you're talking about those who are sexually active are at higher risk, and of course those who get a sexual debut early in life. Then does it mean that those who are not sexually active, say virgins for example, are they safe in this case?
Basically, most of them, as I mentioned, most of the causes are HPV, and HPV is usually acquired through it's sexually transmitted. Not necessarily penetrative sex, but also can also be acquired through just touching of the intimate areas, you know. So even that can cause one to acquire the virus, but primarily the mode of transmission is sexually transmitted. However, there are 10% that are non-HPV associated. So I'll not really delve much into that. I think most of the cases we see in Kenya are associated with HPV.
All right. You also mentioned something about HIV women who are also at higher risk, of course, aside from those who are sexually active. But are the people who are HIV positive at risk mostly because of the HIV virus in itself, or why are they at high risk?
So why these women would be at a high risk is because HIV basically destroys your immunity. So when your immunity is low, your body is not able to clear up that virus. Just like even women who would be on immunosuppressants, any drugs that would suppress the immune system, say chemotherapy or renal transplant patients, these women would have the ability of their cells to clear up an infection is less. Just like HIV, so women who are HIV infected, their risk of developing cervical cancer increases by 6 to 7-fold because of that inability to clear up the infection. And the most common HPV viruses are the type 18 and 16. So these cause majority of the cervical cancer cases. Say about 70% of the cases are caused by these two. The others, as I mentioned earlier on, we have 14 to 15. So the others would cause a bit of the other strains can cause the rest, about 25 to 30% of cervical cancer cases.
All right. And we do encourage viewers to send us feedback and also questions if at all they have for you. They can also call in live if you're watching. And the question you're asking on social media, what cervical cancer myths have you heard that might be stopping women from getting screened or vaccinated? Our phone number is 07267 Talk to us. Fred, tell us what the people are saying.
All right, thank you, Anne. Indeed, the question of the day, what is cervical cancer myths have you heard that might be stopping women from getting screened or vaccinated? Use the hashtag Morning Cafe TV47. Let's sample some of your feedback now. Mary, who's watching from Rongai, thank you so much. She says, is it true, she's asking, is it true that cervical cancer screening is very painful? She says she's avoided it because of fear. Yeah, Dr. will be telling us about that. Janet, watching us from Nakuru, she's asking, I've heard the HPV vaccine can cause infertility. How true is that? Does it cause infertility? Let's have some more. Faith, who's watching from Thika, she's asking, can a woman who's not sexually active get cervical cancer? Yeah. Or is it only affecting those who are sexually active? And Brenda, watching here in Nairobi, my friend says screening is only for older women. Should young women also go for screening? Is there an age factor in this one? Another question, is cervical cancer hereditary? My aunt had it, and now I'm worried. This is Lucy, who's watching from Kisumu. Oh yes, so quite a number of questions, and I think Daktari has noted them. Anne, can you get us those questions answered, please?
All right, thank you so much for that. A lot of questions from that end, Fred. And of course, we do encourage more on our WhatsApp number, 0793-267-279. Talk to us and we'll be happy to hear from you. A lot of questions, Afrin. An issue of screening. When is the right age to start screening? Because you see, they say from the comments we've read that it's only for older people. Is that true? And at what age should screening begin?
So ideally, screening should begin at 25. As per the National Cancer Control Guidelines of Kenya, we screen from 25 years of age up to 65 years of age. This is, having said that, of course, we can bring the age down, particularly in HIV-infected individuals whose sexual debut is earlier, say 21 years of age. Now, having said that, why we would want to screen from 25 years onwards and what are the methods? And I think one of the audience asked, is the screening painful? I think there's a lot of barriers. Some of the barriers to screening, one of them that we frequently hear is, I don't want to go for the screening because we feel or we find it very invasive. So yes, sometimes women would feel that because it's an intimate exam. You're examining the private areas, and you would put an instrument, as I mentioned, we put an instrument that looks like the mouth of a duck, which is called the speculum, so that we are able to visualize. But currently, at least, we are moving away to less invasive methods such as the HPV self-sampling test. Now, this test basically allows women to collect the samples themselves. So we give them a swab, they're able to get a swab of the cervix and vagina. It's usually very painless, actually. So you're able to do that, and then you give it to the healthcare provider, and then this is run in the pathology lab, and you get your results. So these are the newer methods. So as per our current recommendations for younger women, say the women in their 20s, we would want to start with pap smears. And why we say that pap smear is what we would want to do is because younger women are likely to get the HPV infection and clear it really fast. So we would not generally want to do HPV DNA tests for these women. We would want to do pap smears, and then women who are 30 years and above, for them, yes, the recommendation is with a high performance test. And now why, which is the HPV. And why now I would focus on the two, or zero in on the two tests, the HPV. So the HPV test detects the virus. Yes, you may have the virus at a small level that is not detectable, but when it is detectable, then we would want to run further tests on you and see, do you have any changes in your cervix that could eventually become cancer? So the duration for these screenings, we put them as if you're doing the high performance test, the ability of the HPV DNA test to detect is very high. It's over 90%. Some literature would even say up to 95%. So once we know it, that's why we call it as a high performance test, you know. So if it's negative, that means we can at least give you a break of 5 years if your immune system is robust. So the next time that you are warranted to screen would be in the next 5 years. For the pap smears, we generally tend to screen at every intervals of three years. So if you have negative pap smears, then the next pap smear, and you've been doing your pap smears routinely, the next pap smear would be after 3 years. So why we put these intervals is because the virus itself, from the time you get infected with the virus to the time the changes happen, to the time you develop cancer, can range anywhere from 5 years to up to 10 to 15 years. So you see, during that time, you have ample time to detect and make or offer the necessary treatments. So that is why hence we have these intervals.
Yeah.
We don't recommend screening annually unless, again, your immunity is suppressed. The scheduling for women who are HIV infected is slightly different. For them, we would recommend at least annual screenings with pap smears, or if they're using the HPV DNAs, between 2 to 3 years. That's the recommendation.
But just still on people with HIV, are we doing enough targeted outreach for this high-risk group?
Yes, the targeted outreaches are there. We do integrate into the clinics, the PMTCT clinics. However, there are again a lot of barriers to picking up these vaccinations and screening as well. And one of them is women would just not come because they feel the exam is painful. So these are some things and some barriers that we as healthcare providers, as a community, need to overcome. But to do that, we need to integrate the community at the community level. We need to create more awareness, and programs such as this where we talk about cervical cancer. At least now we see a lot of people commonly coming and talking. You know, it is an intimate area. There's a lot of stigma associated with that. There's a lot of, you would hear women say that we don't want to come and talk about cervical cancer because, you know, people will think that we are promiscuous. You know, they would equate cervical cancer with promiscuity. Again, that creates a lot of shame and a lot of fear in people to come and say. You know, the whole essence of I'm going to a doctor to get screened creates that kind of mindset. And then again, we come to the multiple sexual partners. I actually have heard this a lot on social media and also from people, from women directly, you know, that is my partner cheating on me? That's not the case. You know, even when you have a single partner, the risk of you having a persistent infection is still there. It doesn't necessarily equate to a cheating partner. And I think these are things that we need to talk about more openly. Just that when we say multiple sexual partners, we just mean that the risk of your exposure to HPV is higher. However, having said that, it does not mean that if you have a single partner, you do not get HPV. You can get HPV and you can develop cervical cancer.
So still on that, the conversations that we see a lot online is that men are the people who give women cervical cancer. Is that true?
Well, I wouldn't say it that way.
You'd be a little bit nicer.
So yes, the virus is basically transmitted sexually and they can have the virus. But having said that, the virus itself also in men can cause cancer, such as penile cancer, oral cancer, also esophageal cancer. So that's also there. But I wouldn't necessarily say that men are the primary, can I say, people who give or who cause cervical cancer. It's just a sexually transmitted infection, and it can be transmitted from one partner to another partner. And
then another question is, maybe in the older ages, we didn't used to talk about cervical cancer as being something that is caused by sexual intercourse. Then what is different in this day and age such that we are open to saying that, you know, cervical cancer is now caused by sexual intercourse? What is different?
The difference is people are getting more educated, people are becoming more aware.
Just allow me, and also that question of those families who are polygamous, then were they not getting cervical cancer, those women?
I'm sure they were getting, it's just that we were not detecting. Right now people are openly talking about it. The cases have been there, a lot of cases, it's just that we are coming forward and talking more about it. Before, let me give you an example. To just mention the word sex would be a taboo, you know. If you walk into a room full and you talk anything about sex or intimacy, everybody will look at you like, you know, what is wrong with you? But at least now the younger generation that is coming up, and even us as adults, we are more open to it, we are getting more educated, we are more health conscious. As before, but I think before I would say it was the society, the norms, the culture. As we know, there are a lot of cultural barriers that contribute to talking about it, and I think that is one of the reasons that we still see most of these cancers very rampant in specific parts of the country, you know.
So what was, say, the risk of not seeking after treatment for these people? Maybe those who are there before us, when it's not detected early or when it's not detected at all, then what's the risk of that?
So what happens is when it's not detected. So as I mentioned, cervical cancer has a long period from the time you get infected to the time you develop cancer is a long period. And in between you have a lot of time to intervene. It is one of the cancers that is highly preventable. Yet you would see every single day in Kenya, you'd see 9 women dying of it, which is quite shameful given that this is something we can prevent. And when we don't come early, what we see as clinicians, when women come, they're oozing pus, discharge, the smell. You know, it's like flesh that is rotting.
Yeah.
So that is the kind of things we are seeing from this cancer. Of course, treatment is very, very difficult and very expensive. When we come early, the cost of cancer treatment versus the cost of prevention is quite different. You know, cancer treatment is not like, say, pneumonia or diarrhea, where you say, we treat and you're done. It's a long, long treatment.
And we'll be getting deeper into that.
Exactly. It financially depletes families.
Yeah.
So I would definitely always advocate for early detection, prevention, and advocacy. We come and get treated, because even the symptoms, the life, when you have cervical cancer, you know, you're constantly bleeding or you're constantly discharging. And then, of course, as the cancer spreads, say it's spread to the lungs, you know, you'll have issues with the lungs, brain, you'll have issues with the lung. I've seen women who have had fractures or who were not able to walk because the cancer has gone to the bones. So it is difficult. And of course, you at that point, even the treatment outcomes, meaning whatever treatment modality we do, either it's radio, chemo, or just chemo, you know, the outcomes essentially become poorer. We're not able to treat it as effectively, or we're not able to get the desired outcomes as we would have wanted had we picked the cancer early, or had we treated it before it developed into cancer.
I want us to go back to the point you talked about, screening. Of course, there are efforts to try and make it easier for women who are scared of the invasive method, pap smear. You've talked about right now you're giving women swabs to go and do it themselves, but I was also seeing on social media that right now it can actually be done using, you know, menstruation. Is that effective? Like, you know, you take some bits from your pad when you're during your menstrual cycle, and then you take it to the lab, and then it's used to detect if at all there's HPV.
So it's an exploratory thing. It's under investigations. One, we have robust data that it is as efficacious or as effective as when we're giving women the swabs. Then definitely those are some of the methods that we would want to adopt, you know. The other is, I think there's also a study that is testing the urine. But again, we wait for evidence that suggests that is equally effective and not something that may not be equally effective. If it is, I think those are wonderful methods, and that would definitely increase the uptake of the screening in our women.
How is the health-seeking behavior in this day and age? Now that we're open to talking about cervical cancer, we have things like pap smear, and you know, we said women are scared of pap smear. I wonder if that in any way affects the health-seeking behavior of women. Are they shying away from coming to hospitals, or is that changing even as we continue to create awareness on cervical cancer?
I'd say it is slightly changing, but we have a long way to go. Again, some women, so now when we talk about the urban areas and the rural areas, you'd see that kind of behavior, say, in the urban areas. If you come to Nairobi, yes, you have a lot of access to facilities and you're able to go. When you go to the rural areas or extreme interiors or peripheral areas, you know, that kind of behavior is not very common. Again, this not only has to do with the women not having access to the facilities, but it also has a lot to do with a woman's responsibilities in society, that everyone seems to think that this is their responsibilities, you know. So they'd keep pushing that going to a healthcare provider is at the back of their list, you know. The other is also the female autonomy. I think, again, I'd put that in urban areas where most women are working, they have their own financial independence. Well, when we go to the villages, you know, most of the women would be heavily dependent on their male partners. So it becomes very difficult sometimes for them just to get that amount of money to go to a health facility. So it's, yes, the health-seeking behavior is also decreased, the education levels also, but it's also a lot to do with the cultural norms and what happens and what's more common in those areas. So it's not a one shoe fits all size, you know, kind of thing, yes.
There's also, I don't know if this is misinformation or if at all it's a myth, that HPV, you know, a lot of people are still debating on this. Some say it doesn't necessarily cause cervical cancer. Others say that it can cause permanent disabilities. What is really the disconnect when we're talking about HPV? What don't we quite understand about this virus?
I think there's a lot of myths, particularly when we come to not the virus per se, but the vaccination. As I think one of the audience asked, does the HPV vaccine cause infertility?
Yes.
Or even I've had women come and ask, does it cause promiscuity or change behavior or sexual behavior in teenagers and young adults? Well, when we look at it, the vaccine is extremely safe and it prevents over 90%, almost, I think some literature would say 99% of cases of cervical cancer can be prevented with the vaccine. But again, let me explain how the vaccine works.
Okay.
So the vaccine is basically, can I say it's like a guard, like a security guard to a house. You have a door and there's a security guard. So what the vaccine does is it forms antibodies locally around the cervix, so there are cells that develop what we call as antibodies. So when you get infected with the virus, those antibodies destroy the virus. So this is what it does. It's just like, as I mentioned, there's a security guard that is protecting your house, and then you have an invader that comes. The security guard, say, has a gun and is able to shoot or, you know, prevent the invader. Likewise, that's what the vaccine does. It will form a layer of security around your cervix. So when you get infected, it will prevent that. It will destroy the cells of that virus. So that's what the vaccine does. However, that's why we prefer to give it before sexual initiation. And why that is, because once you get sexually active, we would like to presume that, yes, you are at a higher risk of getting infected with the virus. So the efficacy is more when you give it before sexual debut. However, having said that, that's why our target group would be girls and boys aged 9 to 14 or 15 years. Given the availability of the vaccines that are supplied in the country at free cost, we target essentially girls. But we need to vaccinate the boys as well.
Okay.
And these vaccines are not very expensive for the boys. They can get the vaccine as well. For the girls, these vaccines are free. You can go into any county hospitals, even a lot of private hospitals. At very subsidized cost, you'll get the vaccines. So they're very, very available, and they're very safe. They do not change sexual behavior in young adults and teenagers, and they do not cause any infertility or sterility in women or boys.
Are we reaching the 90% vaccination coverage by any chance? When you look at how we're doing in Kenya, are we reaching that goal? Of course, this is one of the targets by the WHO, 90-70-90 for vaccination.
Okay.
How are you doing?
Yes, 90, we are not yet reaching there, but we are about 60-62% with the vaccination. So from 2025, we adopted the WHO strategy. Previously, before 2025, we were giving 2 doses to the young teenagers and 3 doses to children aged 15 years and up to 26, young adults up to 26 years. But recently, as per the WHO, we have adopted the single-dose vaccine. That is, 1 dose is sufficient. It causes enough immunity in children aged 9 to 14 years. And however, the uptake is still slow. We are, as I mentioned, we are at about 60-62%.
Right.
Or we need to do much more better. We need to do more to reach our target. And recently, the Ministry of Health launched the 90-70-90 strategy, national strategy for elimination of cervical cancer. And so with that, we're hoping that at least we're able to achieve the target by 2030.
Before we get feedback from our viewers to listen to what they're saying, so do you agree that the vaccine itself doesn't cause disability?
No, it does not cause disability. It's quite safe. It would cause the normal symptoms that any vaccine would cause: fever, which is common, usually subsides. Pain, when you get any jab, you're likely to get pain in your hands.
Yeah.
These are common symptoms, but these will usually, side effects usually subside in a day or two. Yeah.
All right. Let's go back and take a look at what the people are saying. Our question of the day: what cervical cancer myths have you had that might be stopping women from getting screened or vaccinated? Our WhatsApp number is 0793-267-279. Talk to us, Fred.
Yes, thank you, Anne, and we continue debunking some of the myths that you may have about cervical cancer. Let's see what people are talking about now. Anne, who's watching from Embu, she says, I was told if you have no symptoms, you do not need screening. Is that correct? If you don't have any symptoms. Wanjiro from Nyeri, can cervical cancer be cured if detected early? That's a direct question to you, Daktari. Can cervical cancer be cured if detected early? Let's have another one. Sharon, watching from Eldoret, does the HPV vaccine work if someone is already sexually active? Like if you receive the vaccine after you're sexually active. And Caroline, watching from Mombasa, is asking, are screenings expensive in public hospitals? Diana, watching from Kitengela, I've had cervical cancer means you can never have children again. Is that always the case, that once you get cervical cancer? Let's listen to some audio notes that we have received. All right, let's continue sampling some feedback. We'll go back to the voice notes in a short while. Esther, watching from Kericho, is asking, can men carry HPV and pass it to women? I think the doctor had already answered this one, but then again, it's a good question. Can men carry HPV and pass it to women? Back to you, Anne. Let's get this answered.
All right, thank you so much for that. We are receiving a lot of feedback and, of course, a lot of curiosity surrounding HPV vaccine in itself, if at all it's effective and everything. But somebody has said there that if you have no symptoms, there's no need for screening. Then talk to us about the signs and symptoms about with cervical cancer. Some call it a silent killer. Is it a silent killer? What are the things to look out for?
So basically, this is a very good question, an important question. When you're asymptomatic, do you need to screen? Actually, that's the main reason you screen. Screening is to pick up the changes early, so you not have any symptoms, and hence the necessity for screening. Now, cervical cancer signs and symptoms, basically most early cervical cancer is basically asymptomatic. You may not have any symptoms. However, some of these signs and symptoms that you may see are bleeding. Bleeding after intercourse. This is one of the most common symptoms that you would have. You would see bleeding after intercourse, or sometimes you can have bleeding in between your menses, excessive bleeding, heavy menstrual bleeding. For postmenopausal women, bleeding, postmenopausal women don't bleed, but now they will have bleeding because of the cervical cancer. So these are some of the first signs and symptoms. The other thing is discharge. By the time you're getting discharge, you know that cervical cancer is advanced. And then other symptoms and signs will depend on where the cancer is spread. Lower back pain is one of them. Lower pelvic pain, meaning lower abdominal pain, is another symptom. So these are some of the most common presenting symptoms that women would come with.
Talk to us about some of the contributing factors. Now, not to HPV, but to cervical cancer. We've heard a lot about, say, pills that women take. What is it called? Is it family planning pills? Yes, family planning pills, birth control pills. Of course, if somebody has undergone multiple childbirths, I don't know if that's true or if that's a myth, but tell us about the contributing factors to cervical cancer.
Great. So some of the contributing factors, as you mentioned, yes, multiple childbirths can be a risk factor, and that is not the fact that it's multiple childbirths, but it's just the fact that when you have multiple childbirths, the process causes something we call as ectopia because of the release of estrogen. So that exposes your cervix more. It causes your inner part of your cervix to protrude outside, and then those the cells in that cervix now undergo changes, and that is one of the reasons why you would associate that with this. The other thing is the COCs. Well, this is another issue that I know a lot of women would not take COCs because they say it causes.
What are COCs?
Sorry, COCs are combined oral contraceptives.
Okay.
The pills, what we call as the pills. They don't necessarily cause as such cervical cancer, but long-term use, say long-term over 10 or 15 years, may be slightly associated or increase your risk of developing cervical cancer. And that's because, again, as we said, because of the ectopion, meaning it causes the cells of your cervix or the part to come out, and as when we describe cervical cancer, it's a bit technical. So the cells from your cervix change from one cell type to another cell type, and this happens throughout a woman's reproductive cycle. So those cells that, when they're undergoing these changes, that it's a normal physiological phenomenon. So when they're changing from one cell type to another, they are immature. They're not as mature, they're not able to withstand the injury as much. So that is why they become more susceptible to injury and HPV infection. That's the whole thing. But as such, the benefits of the pills outweigh the, can I say, the small risk that may be there. Of course, that is why we bring in screening, and we're able to screen and we're able to pick up these changes. The other thing is cigarette smoking. Cigarette smoking, again, releases certain harmful chemicals around the cervix, and now these chemicals then increase your risk of developing cervical cancer. As we discussed, multiple sexual partners, sexually transmitted infections such as chlamydia, gonorrhea, or any other sexually transmitted infections also increase your risk, or can I say they would increase your risk. Yes, you need the HPV, but these are other risk factors that you would require for the infection to persist or then, can I say, progress into cancer eventually.
Does genetic predisposition has anything to play when it comes to cervical cancer?
Not particularly. We still have some gray area in research that is going on, but as such, I can't say cervical cancer per se is genetically associated as,
There's a question that came in, HPV and men. We talked about that you also encourage a HPV vaccine among the young boys as well, but with women you said around from 14 years before, their sexual debut. How about men?
Likewise, the same with men. Particularly, we would see certain cancers in men who have sex with men. They're also more predisposed to getting these infections and also eventually developing these cancers. So even for them, we would advise them to get vaccinated, pretty much the same ages. The other thing is, I think someone asked, once you're sexually active, can you get the vaccine? The answer is yes, you can get the vaccine. In fact, we call it as catch-up vaccine, but again, it does not negate the fact that you still have to continue screening. Yes, you can get vaccinated, but you need to continue regardless of that. Just like any vaccine, even if you get a vaccine for tuberculosis, it will probably prevent severe forms of tuberculosis, but it will not make you not ever get tuberculosis. Just like that, yes, you get vaccines, yes, but you still need to continue with the screening. And even older women can get vaccinated, but the only thing is the efficacy of the vaccine reduces.
I want us to go back to the point on pap smear, to be specific. Is it effective in telling the general health of the cervix? Has it always proven, even when there are no symptoms? You're talking about sometimes this can be very asymptomatic. Is it effective?
It is effective, yes.
100%.
I wouldn't say 100%. You see, with the pap smears, it's not a high-performance test. In the sense, one of the advantages of a pap smear is it's usually collected by a healthcare provider. So when we put the speculum, we're able to visualize, or we're able to see the cervix, So yes, we may not necessarily have kids say cervical cancer, but it allows us to generally assess your cervix. And when we're assessing, we can see that, yes, there's some problem here, or there's some problem there, Again, it is slightly less efficacious, say less effective in terms of screening as compared to the HPV DNA. As I mentioned earlier, an HPV DNA test is almost over 90% effective in detecting the virus, and then we come in with other tests such as colposcopies. Once we detect the virus, we would come in with the pap smear, or when we use visual inspection using acetic acid, what the ability to pick up the changes is slightly less. It's about 40 to 50%. But having said that, something is better than nothing. You can you can still go ahead and get your pap smears, and in fact, it's mandatory. You do pap smears or HPV DNAs. The others, we want you to do any sort of screening, whatever is accessible and whatever is available.
Let's talk about the cost of treatment or cervical cancer. Is it affordable for each and every Kenyan, say from the screening stage all the way to treatment, and of course after treatment? Is it affordable?
So screening is quite reasonable, and I think almost everyone is able to afford it. If you go to the public sectors, most of these screenings is almost at no cost, or to very minimal cost. The HPV DNAs, again, can range between 5,000 to 6,000, but you would do it every 5 or 6 years. I mean, every 5 years. So you see, it's quite cost effective. Now, pap smears, again, you would see facilities offering it at 500 to between 500 to 2,000. Again, that is quite cost effective. Then when you come to other tests like VIA, most of the public facilities don't even charge. If they charge at all, it's 100 shillings. So this is quite cost effective. But now when you come to the cancer treatments, you know, the cancer, well, when you look at cervical cancer, depending on the stage, the treatment can entail surgical treatment, it can be radiotherapy with chemotherapy, or chemotherapy and immunotherapy. So now when you look at all the spectrum, you know, it's quite expensive. The surgical part itself can range anywhere between 200 to up to 500,000, and this is depending on where you choose. Now you come to the radiotherapy is not cheap either. You have external radiotherapy and your internal radiotherapy, and then there's chemotherapy. Immunotherapy, most of the Kenyans would not be able to afford the treatments. When we talk about it, certain immunotherapies can be between 250,000 to 400,000 every 3 weeks. So, you know, when we put the question of cost, is it cost effective? How much is the government doing? How much does our share pay? We'd say it's a drop in the ocean. It's a lot, it's financially depleting. There's a lot of financial anxiety that is caused in families. A lot of families you'd see doing crowdfunding because the costs of treatment are exorbitant. There are facilities that would allow you to use the SHA, but SHA pays part of the treatment. You almost 100% of the times you will co-pay, and that co-payment can be quite debilitating too. That is another aspect that we can go into for days and days and days. So yes, these treatment costs are quite debilitating to the families as well. They cause what we call as financial toxicity, financial distress. People end up selling their assets. You'd see women saying that I had to sell my farm or I had to sell my house just to pay for my treatments. And this cuts across almost every other person that we come across.
And what alternative is there for people who, you know, are not financially privileged? Say people who cannot afford the 500 Kenyan shillings for pap smear, for example. What exists for them?
So we do have other alternatives. When we go to the public facilities, even some of the pap smears are quite cheap, maybe 100 or 200. The other alternative is the visual inspection using acetic acid. And there are programs also within the country that screen at no cost at all. Even using the HPV DNAs, using the pap smears, as well as the visual inspection. There are facilities and there are programs that are ongoing in the country, particularly in the public sector, that offers the screening at almost very minimal to no cost.
All right, let's hear once again what the people are saying this morning. Our WhatsApp number is 0793267279. Send us your feedback and let's hear what you're saying, Fred.
All right, thank you, Anne. Let's continue sampling some of your questions on this question about the myths Diana, watching from Kitengela, I've heard that cervical cancer means you can never have children again. Is that always the case? I think we've repeated that question because we need an answer. Mercy, watching from Machakos, is asking, is cervical cancer linked to family planning methods? Is there a direct correlation between cervical cancer and family planning methods? Naomi, who's watching from Kakamega, is asking, how often should a woman go for screening? I have a feeling the doctor has already answered that, but it's good to repeat. Joy, watching from South B. Question is, does having one sexual partner eliminate the risk? And the very last one here, Rose, watching from Meru, is asking, are there early warning signs women should watch out for? Yes, these are the questions that we need the doctor to answer. Back to you, Anne.
All right, again, people are curious, Dr. Does it affect childbearing efforts?
So, okay, this is a bit of a long answer.
Yeah.
So again, it depends on the stage of your disease. If it's early disease, say a stage 1, that we can treat it with fertility preserving methods, then yes, we can preserve your fertility and remove just that affected part of the cervix that is affected by the cancer. However, if it is advanced, then it becomes difficult to preserve fertility and eventually the childbearing, meaning it's not possible for us to leave the uterus intact. We would need to remove it, or if you're offering radiotherapy, so basically what radiotherapy does is it sterilizes, not only, it would sterilize the ovaries, so you go into a menopause phase after the treatment. So it is difficult at that point to bear children. But having said that, when we detect it early, when we pick it early, then yes, there are specific surgical methods that we're able to offer where we are just able to remove that part that is affected and leave the uterus intact. And yes, you can still carry a pregnancy to term, meaning you can still bear children and you can still have children after the procedure. Yeah, but this again will depend on the stage at which your cancer is diagnosed.
Are there other conditions that somebody would get, of course, by the fact that they have cervical cancer? Say other conditions, say maybe something like diabetes, for example, fibroids. Can cervical cancer cause other conditions?
No. So cervical cancer is completely different. It will not cause fibroids or it will not cause diabetes. It's just cancer. You know, cancer is just growth of an abnormal cells that keep on multiplying and eventually become cancer. Yeah.
All right, when we talk about some of the treatment options that are there, you mentioned something about a surgery. But now when the cervix is removed entirely, is the woman still at risk of cervical cancer at any point in life in future?
Yes, so the recurrence is always there. So yes, even after treatment, there's that risk of the cancer coming back. Hence, even after treatment, we have this whole follow-up of women that initially we would tell them to come for the first 2 years, we usually ask them to come in at frequent intervals because the risk of the cancer coming back for the first 2 years is pretty high. So we want these women to come in fast at regular intervals, say 3 to 4 months. And then from 3 years onwards to 5 years, they would come at intervals of 6. After 5 years, when we are satisfied that everything is okay, then we now talk about you are treated. You know, whenever we treat you for cancer, we don't say immediately you're treated for cancer. We put it, you're in remission. So after 5 years for cervical cancer, we say you're treated. The risk of the cancer coming back substantially reduces. But yes, even after having gone either surgical treatment or radiotherapy or chemotherapy, you'd still be at an increased risk of the cancer coming back.
So how does the follow-up and follow-through look like for patients with cervical cancer? Do you experience some who stop medication just like that?
Yes, we do have a lot of patients or a lot of women who just stop the follow-ups. And that becomes difficult because when the cancer comes back, again, we're not able to quickly pick it up and act in a timely manner. So basically what the treatment and what the follow-up entails is if you've had a surgical treatment, then we would want to do smears at least annually to examine are there any changes. We can still do pap smears if you've had surgical treatment. But when you've had radiotherapy, you know, radiotherapy changes the normal it changes the normal architecture, can I say, of the cervix and vagina. So pap smear basically does not work in such a situation. So if we're looking down, we do a physical exam, we look at the vagina, we look at the cervix. Again, of note is the HPV virus not only affects the cervix, but it also affects the other parts, say the vagina or the outer part, which we call as the vulva. A woman who's had, say, cervical cancer, she's also at a higher risk of developing vulva cancer. I think that the risk is about 6 times. She can, as high as 6 times, 6 folds. Likewise, she can also develop a vaginal cancer or anal cancer. So this cancer basically is a multifocal cancer. It affects multiple areas. So that is why we need to keep screening. I mean, even after the treatment, during the follow-up, we would look at the cervix, we would ask you for symptoms, and then do certain imaging when it's necessary. And also routinely, maybe once in a year, depending on the stage, we would want to do and see, has your cancer come back? Do you need additional treatment? And when do we need to intervene? So yes, the treatment, the initial phase of the treatment is there, but there's so much more we need to do after treatment, even the life after treatment, you know. Now, this brings me to a very important aspect, sex or intimacy after treatment. A lot of women have had young patients come to me and say, we're not able to be intimate with our partners. And that is something we need to integrate into our practice. We need to ask, again, it's more about educating, and that is why we encourage women to come with their partners from the start to the end. You know, when they're there throughout this journey, they're able to understand. So in Kenya, if you look at the current statistics, or what we see is there's a lot of women would face partner abandonment once they're diagnosed with these female reproductive tract cancers. However, there are also partners who stay and stand with their wives or their partners throughout this treatment, and they're able to understand, because the radiotherapy or even a surgical treatment shortens the vagina, and it makes it makes intimacy difficult. So their part, we take women through rehabilitation, where we do vaginal dilatations for women who've undergone radiotherapy, because radiotherapy would make your vagina narrow, and it makes intercourse very, very difficult. But it is a part of, it is a normal physiological part, and yes, women do need to feel that they're still women. It is a part of the treatment. It's a mental health issue as well. So we need to rehabilitate our women. We need to integrate or discuss this with both the men and the females and their partners.
It gets better though after treatment, their intimacy and the sexual health and life, it gets better?
Gradually, it does get better as you go on, because even menopause, when the ovaries are sterilized, you go into menopause. So menopause itself will cause a lot of reduction in estrogen levels. It will cause reduction in estrogen levels, and so there's a lot of vaginal dryness, and so women find it difficult to have intercourse. So these are some things that we need to be open about, and we need to talk. And women need to get more educated, as well as their partners.
As we wind up and we've come to the tail end of this conversation, one of our viewers asked, is this a curable condition?
So yes, when picked up early, it is definitely curable.
All right, thank you so much. That is Dr. Afrin Shafi, a gynecological and oncologist, talking to us this morning about cervical cancer, what we need to know about cervical cancer, how we need to protect ourselves, and just changes in lifestyle as well. It's not a death sentence. Of course, if detected early, it can be treated. What's your takeaway, Fred?
All right, very interesting conversation there. Thank you so much, Daktari, for answering a lot of questions, because there were very many questions. Sorry for that. There were very many questions, especially from our viewers. Many didn't understand. And I think some of those questions came out as very genuine. And I love the fact that they got them answered. Yes.
All right, thank you so much, Daktari. That brings us to the end of this conversation. Thank you so much for staying with us. We can continue it on our socials.
Yes.
TV47 Kenya on Facebook and on YouTube.
TV47 Digital on X. You can also tag us directly at Fred Indimuli.
At Ann_Dida. Enjoy the rest of your morning. Good morning.
Good morning.